What is multiple sclerosis? MS is a disease that affects the central nervous system, the CNS, the brain, spinal cord, and optic nerves. MS causes degeneration of the nerves. The damage to the myelin sheath, the protective covering of the nerve, creates lesions or scars. The process of developing lesions is called sclerosis, so MS actually means many scars. These plaques disrupt the transmission of information in the CNS and lead to MS symptoms. Who can get multiple sclerosis? 400,000 people in the United States have MS. Usually they're between 20 and 50 years of age when diagnosed, but children and elderly have been diagnosed. Caucasians are twice as likely to have MS than any other ethnic group. The majority of people with MS live in the Northern Hemisphere. Women are twice as likely than men to be affected earlier in life. What happens when multiple sclerosis attacks? One theory is that a virus or a foreign antigen interacts with the immune system and tricks it to think that the myelin, the protective coating of the nerves, is the intruder. Unfortunately, the electrical pulses are slowed and the nerves are damaged. Some of the myelin can be repaired, but some of the nerves are stripped of their myelin covering. The nerves will become scarred from plaques. As the scars are formed, the messages can't be transferred from the brain to the body, so walking, speech, writing, vision, and memory are affected. What causes MS? Doctors still don't understand what causes multiple sclerosis, but in the last 20 years, researchers have focused on the interesting data that suggests that genetics, a person's environment, and possibly even a virus may play a role. The possibility is that a foreign antigen, such as a virus, alters the immune system so that the immune system perceives the myelin as an intruder and attacks it. Research is being conducted, but the viral theory is not definitely proven at this time. However, the attack by the body's immune system on the neural tissues causes this disease to be termed autoimmunity. Is multiple sclerosis inherited? As with any other condition, heredity plays an important role. The general population has less than 1% chance developing MS. The risk of developing MS is greater for those who have a family history of the disease than for those who do not. If one of the parents has the disease, then there is a 1 to 3% possibility that the multiple sclerosis may develop. What are the types of multiple sclerosis? MS is different for each person. Some people are diagnosed and never have another symptom. Some people become seriously disabled. Most people are somewhere in between. Although individual experiences differ, doctors and researchers have identified several major types of MS. It's important to recognize a type to help predict the disease severity and help to choose treatment. We'll discuss each of these categories in the following slides. Benign MS. This is a subgroup of relapsing remitting. It is used to describe the disease in people who have had MS for 15 or more years without any more symptoms. The person with the benign type of MS can expect minor or no progression at all after the first attack. However, calling this case of MS benign is very misleading because over time, short-term memory disturbances, cognitive dysfunction, and some clear evidence of spinal cord or brain atrophy can all be identified via an MRI scan. In fact, in the 20% who are given an initial diagnosis of benign MS, only 5% end up actually having the benign type. Relapsing remitting. 65 to 80% of individuals begin with relapsing remitting MS. Symptoms fade when they return off and on for many years. It is during this type that those who have MS experience attacks, otherwise called exacerbations. They're followed with either a complete or partial remission. It may be weeks to decades between relapses. Primary progressive MS is a type of MS when the person with MS gradually experiences a clinical decline and has no true duration of remission. This is very common in the male population. Just 15% of all the people with MS have primary progressive, but it is the most common type of MS in people who develop the disease after the age of 40. Secondary progressive MS initially starts with the relapsing remitting, which usually persists for several years. About 50% of relapsing remitting MS persons will develop secondary progressive within 10 years. Progressive meaning steadily getting worse. Progressive relapsing is a rare form of MS. The disease has a progression form that starts out from the onset with a very acute attacks that may or may not have relief from the obtained symptoms. Unlike primary progressive type, this type has no tendency to plateau. Symptoms of multiple sclerosis are different for each person. Symptoms may be multiple or single. They may range from mild to severe in intensity and short to long in duration. Common MS symptoms are illustrated here on this slide. How is multiple sclerosis diagnosed? Getting an MS diagnosis is a process of eliminating all other possibilities. One test to aid in this process is an MRI. For a definite diagnosis of multiple sclerosis, at least 2 separate symptomatic events or changes on MRI over time, and at least 2 separate locations within the central nervous system, which can be demonstrated by MRI or neurological exam, is usually required. How is multiple sclerosis treated? At this time, there is no known cure. For this reason, we look at ways of treating MS symptoms and ways of slowing the progression of the disease. Multiple sclerosis is a disease that changes the lives of most people who are diagnosed. Treatment options will be discussed in the next video.